All right. Thanks, Steve and Dr. Bush, for inviting me and just all of your continued support and partnership over the last couple of years as I've been in this role. So my name is Beck Whipple. I am the statewide suicide prevention coordinator here with the Department for Behavioral Health, Developmental, and Intellectual Disabilities. And I've just been blown away already this morning by the presentations. And I hope you heard through the morning how important data is, how important partnerships and relationships around data and data sharing and making that data actionable, how important that is. And then also how to, get in front of our youth, our military connected youth as folks who support them and hear them and want to kind of be in their life. So what an honor and a privilege to be here today and to talk with you all. If you have any questions or anything that comes up during the chat, please let me know. I'm going to try to make this as interactive as possible because I know I'm like right after lunch and that chili you just ate because it's getting colder outside. It's going to start to wear on your energy. So hopefully we can make this as interactive as possible. But yeah, how do we use data, right? How do we use data to inform prevention? And kind of particular in this one way with the crisis text line, I want to share a little bit of that information and data with you to see what you all think we should do with this data and what and how we might invite you all to be partners in that. I do want to take a pause. Anytime I talk about suicide, I really want to just say, hey, this is something that we're going to talk about. We're going to look at specific numbers related to suicide thoughts and incidences of people thinking about suicide and reaching out. And so I want to just give a moment of pause to say, suicide prevention really starts within our own brain and body, and how well we take care of ourselves is really kind of the most important, because if we're taking good care of ourselves, recognizing what our capacities are, what we might need, and doing that good care for ourselves, we prevent our own mental health concerns, but we also model how we can do that for others. So we are going to talk about suicide. So if this is not your hour to want to hear about it, it is okay. We'll be here. This has been recorded. You'll get the slides. So please do something to kind of take good care of yourself. If this is not the time and the place that you're able to kind of hear about this data. I want to just give a huge shout out to a couple folks. When I started in September of 2019 in this position, I had really no history or experience working within the state system. And so it was a crash course in who was who and what they were doing. And probably one of the kind of what I'm kind of most proud of and what I'm most excited about is this coming together of a Kentucky suicide data team. So you see here, we have kind of three partners on this circle surrounded by Kentucky suicide data. And Dick, I really appreciate you putting in the chat about the trauma, because trauma obviously is the kind of driver to a lot of the psychological pain that drives suicide. So our partners at the Department of Public Health, you met Jan this morning. Saw Sarah Roberson was on here. Her team, her epidemiologist team of John Prather and Gus, they've been super helpful in getting us set up with some essence data, which is syndromic surveillance. A lot of those words I entirely don't understand myself, but Sarah and her incredible, talented team do, and they tell us what's going on. Also want to give a huge shout out to Kiprick, who I think Dr. Bush and Steve work with and for. And so, and then also our partners, myself and others, my boss, Dr. Patty Clark, and other folks at the Department of Behavioral Health. We were working, cordially. We all knew each other. We kind of knew what was going on, but we really didn't have a formalized kind of meeting plan. And so starting in 2020, there is I do not believe that there is no good part of COVID, but I do think that the relationships that COVID has helped foster are going to be beneficial even moving forward. So in the midst of 2020 and this pandemic, we knew that we were, worried about mental health. We were worried about the social or the physical isolation and all of that was going to take a toll on And so, yeah, we started to meet. And so we meet now once a month of our public health partners and our KIPRIC. KIPRIC also is where Kentucky Violent Death Reporting System is housed. So Dr. Seals, who you heard this morning, so her, Dr. Sabrina Brown, Dr. Dana Quisenberry, other folks, we all meet once a month to go and look at this internal data that's not available to be kind of shared because, you know, it might not be big enough data. It might have identifiable things, but with our memos of understanding and our kind of internal working team, we begin to think about like, okay, let's look at the data. What's going on now? All right, we're doing prevention. So how can we levy our social capital, all of our partners that we're working with? How can we do that? So, you know, the big part of this is that we've been sharing information, we've been sharing data, but we've really been sharing energy and kind of brainstorming of what to do. And honestly, some of this data it's complex. You know, shout out to any epidemiologist out there. Yeah, what you do, I don't understand, but you know, there's a great group of folks who kind of make that data shareable so that we can all understand it. And that also it's trustable data, that we're not just going out there releasing stuff, but it's been vetted, it's been, you know, kind of cleaned, and what we're releasing really does show an accurate representation of what's going on with suicide attempts, and suicide hospitalizations, and call centers are also something we look at. So I'm very, very excited. Know that we meet monthly. And if you're saying, hey, this is what we're seeing in our area, reach out to one of us, Dr. Bush, myself, and we will be more than happy as a data team to look at it. We have something that we've kind of been tracking you know, in the last several months that we're going to talk about in November, and hopefully you'll hear some actionable items from that conversation. So just trust that there are a really talented group of folks meeting and looking and again trying to make this data usable. And you might not see the actual data because, again, like I think Jan mentioned, every data point is a person. And that person is a part of a family, is a part of a community. And when we're talking about something, you know, with the impacts of suicide, Dr. Julie Searle at U of L says, or UK, oh, excuse me, you know, mentions that about 135 people are affected by one suicide death. And so when we're thinking about and looking at data related to suicides, we need to be really, really careful that we're taking into consideration the humanity of that person that we're talking about, that we're looking at, and also respecting their family and community. So that's kind of something that we're really passionate about. So this is, again, us, how we're bringing this, right? Each of us has our own level of expertise. You know, KIPRIC, DPH obviously is in the public health sector, and they're doing a lot of great things within our county health departments, our you know, other areas, ad districts, all of those kind of things. We work within the community mental health system. So we're working with our regional prevention centers. We're working with our crisis call directors. We have some partners now at the Kentucky Department of Agriculture and the UK Southeast Ag Center and the WKU Ag Center that, you know, we're looking at rural suicide and particularly the stress on farmers and their families. So some things that are going like that. We've also got working together on a COVID emergency response for suicide prevention grant. And we were thinking about, you know, suicide in Louisville, like everybody was saying it was going up, we're really worried. And when we looked at the data, it didn't show that. It showed that over the last several years, suicide deaths have went down in Jefferson County. So those are moments to say, hey, what's going well? How can we expand on that, right? And instead of the message of suicide always being, you know, it's getting worse, I think we have to kind of begin to look at data differently in the way of what is working. You know, suicide, just the word, brings, you know, visceral responses to folks. And so we have to be really careful on how we present that data, and so that we're not just feeding into the hopelessness and the helplessness that this is data that's going, you know, that this is something that is that we can't make actionable, or we can't, you know, decrease, right? So it's been something that we've been working on quite a bit too. So you'll see all of the individual partners, again, our DPH folks, you know, have been working in the midst of what they were dealing with COVID and being able to track and do contract tracing. Sarah and her team and Jan and their team were just so gracious. They always made space, always made room for us. You know, if there was a last minute something that needed to be reviewed, it was done. And so just, I mean, incredible folks. Kiprick, again, you know, they're doing some grant evaluation for us. They do things like case span, where, you know, looking at kind of the overall injury prevention. And Ashley and Steve have helped partner. And this data that you're about to see is through their efforts in writing a grant to be able to purchase this data, this dashboard that you're about to see. So partnerships save lives. Kind of like the relationships with our lives is the very first part of suicide prevention. Relationships on a macro level also help save lives. So I want to just kind of re-emphasize, you know, none of us are alone in this work, and it can get to be very overwhelming. You know, if you're in a nonprofit, that's one of the biggest things, right? Is feeling alone, like you're uniquely dealing with some of these stressors. And when we talk about them openly and honestly, we recognize we're not alone, and we kind of get some relief and again, hope and help and creativity, not just one person. I want to highlight that Jan in the chat said, hey, what about Purple Star for this project we're working on? Absolutely. I didn't think about that. And Steve Cameron's desk is quite literally right next to mine. And so it's going to take all of us kind of brainstorming and being creative. So I love that. All right. So the crisis text line. Crisis text line is a national group that uses volunteered and paid staff to answer your text and chats 24/7. I want to be real clear that they're different than the National Suicide Prevention Lifeline, which is the 1-800-273-TALK. So the 1-800-273 National Suicide Prevention Lifeline is over here, and Crisis Text Line is kind of a sister agency. They're related, but they're not owned or under the same kind of umbrella. So they're two different points of crisis intervention. And I'm going to talk a little bit later about the National Suicide Prevention Lifeline, but right now, let's talk about crisis text. So in the chat earlier, if I'll also repost it, but through this effort with K-SPAN and KBID and Dr. Bush and Steve, we were able to purchase a crisis text line dashboard, which came with two unique keywords. So traditionally, generically, anybody can text home or text hope to 741-741. And that just gets sent to this national database, and we can cipher through that. But now we have our own key branded word for Kentucky and also Louisville. So in the chat, I put the marketing assets that you can download for your own use. One is for Kentucky as a whole Commonwealth, and we also have one specifically for Louisville. It's text LOU, L-O-U, to 741-741. This is a social media graphic that our communications person created. So if you want it, I can share that as well. But yeah, lots of marketing stuff in that Google Drive. Please, please, please use it, share it far and wide. And you know, we're going to be looking at kind of some of the information we get from that. A little bit of background. So when so I have a 502 area code on my cell phone. So if I text that 741-741, if I just text home or hope or a generic line like that, then that routes by my number, where my number was issued. So I live in Kentucky now, but say I moved to California, which I'm not going to, but I'm still texting 741-741 from my 502 area code. Kentucky would get that data. And so geolocation, or what we use in our phone to tell us where we are, geolocation is not used in our crisis text or our National Suicide Prevention Lifeline yet. I believe that we are probably moving more towards that way. But when we use KY, you're giving us that, yes, I'm in this state specifically, I'm texting to this number, and we're gonna be able to look at that data in almost real time, like the next day. So that is really unheard of. All of this information that you're about to hear is de-identified. So we never know who. We kind of just have general demographics and area potentially. So want to make sure there's that. So what is this? So this is our general dashboard that we have access to. And if we have a second, I can actually log into the dashboard and scroll around so you guys can see it. But since 2013, so it's a rolling dashboard, gives us information, all of the historical information. So since 2013, we have had primarily 87% of our white Kentuckians have used the text line. You can see a breakdown also by race and ethnicity or origin. You know, this is an area too where I think we can see where we might need to intervene. So as I go through these next couple slides, I want you to be thinking, how can I use this data? How can we in Kentucky use this data? So in the age, you'll see that darn near everybody that used the crisis text line was 24 and younger. That was the largest portion of use. And you'll see 13 and younger, right? Jan mentioned the child fatality reviews and how young our kids, you know, are that may be experiencing a mental health or suicidal crisis. You know, this is something that's accessible to them. We've been hearing that, you know, again, kids as young as 8 know what the word suicide is and what it means. And so we really encourage those that have young people to think about and research and learn about what are developmentally appropriate ways to talk to someone about mental health crisis or concerns, and even suicide perhaps. So be thinking about that. You know, my good friend Marcy mentioned in the chat earlier on, like, yeah, a lot of data is male or female, and folks like myself, other non-binary folks, we may be not represented fully. And, you know, that's also something I've very much heard KVDRS thinking about, looking at and trying to think about how to more accurately represent that data. But the crisis text line and this dashboard we have access to ask people more of a you know, non-binary responses. So you'll see we have 1% of respondents or texters being you know, agender. A large portion are 80% are female identified. So they recognize themselves as a cisgendered female person potentially. And then we have gender queer, which I cut that word off. I apologize. You know, 2% males, 17%, and 4% of texters or chatters are trans. So I love the capacity for us to be able to look at the breakdown of gender. And again, not just in a binary. It also talks about sexual orientation, which is a little bit not entirely fully represented appropriately. So it says LGBTQ+, and the T would be more about gender identity. And so that's not sexual orientation, but that's a whole nother training that we can provide. So yeah, just looking at the percentage of folks, that's a large percentage of people that are lesbian, bisexual, trans, queer, questioning, that are using the crisis text line. And again, thinking about predominantly white, predominantly 24 and younger, and almost entirely female, right? So those are folks, you know, that this data is representing. It also, this dashboard has the ability to look at disability or, you know, other differences that could potentially be drivers for folks. Again, not because of the identity or the, you know, being differently abled, but just a way the world maybe doesn't make space for you. So ADHD, dyslexia, visibly impaired. So thinking about some of those is also really great to be able to see. So this is what I see on our dashboard. So this is the last 30 days. And so the graph tells us every day how many texters or chatters, you know, use the service. So we saw, again, in September, mid-September and on, we saw a little bit of an increase. You'll see too at the very bottom. So in overall, throughout the use of crisis text line, Kentucky has had 84,000 text conversations. Those are just conversations. We'll also see that of those conversations, those came from 41 specific texters. So that tells me that when someone uses a text line, they're using it about twice per use. So a texter is one individual person. Conversation is how many times overall the crisis text line was used. So it's about 2 texts per one user. You'll also see a satisfaction rate, and then also how long how quickly they were able to be, interacted with in that crisis text way. So someone responded to their text or chat. You'll also see, and a lot of people don't know this about the National Suicide Prevention Lifeline and the crisis text line. All of them have policies about imminent risk. So if they're texting someone about, and they're recognizing that they're at imminent risk of suicide or harm to themselves or others, they will implement what they call an active rescue. At this point in Kentucky, and we're working on that kind of across the Commonwealth, right at this point, that's law enforcement. So, thinking about, that as, and every one of those red dots equals an active rescue. So in the last 30 days, there was 13 active rescues from across the state. And that's almost, one every other day. And so that tells me, those are things to really be aware of. And also these are 2 active rescues. So this is 1 active rescue, these are 2. So on certain days we had more than 1. The next part is, and again, there's a lot of EPIs on this call, a lot of data folks on this call. I've been told that the level of this graph and how it works. So this is call or text or chat distribution across 2-hour timeframes across the week. So when we first saw this, like my jaw dropped, because every single day of the week, and this is since I've been looking at this, which has been about 4 or 5 months, every single day of the week from 10 p.m. to 12 a.m. midnight Eastern Standard Time is our highest level of volume for crisis text line. Every single day from 10 p.m. to 12 a.m. So that's telling me that they're predominantly young, white. This is just who's been, surveyed. This has just been who's using it, not who we could, market this to. But yeah, 10 to midnight every night. So what can you do with that information? I really want to know. So put it in the chat. What do you think from 10 to midnight? What can you do knowing that every night of the week, this is when our highest use of the crisis text line goes into place? And, I wasn't surprised by this once I saw it. It's people are most alone, extra staffing on phone calls. Yes, absolutely. Thanks, Charles. Social media marketing, right? Who's on TikTok? Get you a TikTok at 10 p.m., right? Kind of putting those things out there. Thanks you, Estrella. Yeah, it's a great suggestion. So be thinking about that. And think about who's not represented in this data, right? And how can we, how can we get this in front of them? How, from the data that you saw from Jacqueline and Jan, our young males are dying by suicide, but they're not texting. So that's a whole group of people that we can think about specific marketing for. You don't have to talk. You can just text or chat. Maybe that's something that's a little bit more appealing to our male identified younger folks. So kind of thinking about how can we make this specific, knowing that they're not using it, right? Can we put it on, I know that the Big Sandy REAC put the number on footballs for football games, the little things that you throw out. So can you put it on swag? I know it should be because of Kentucky statute now, legislation, that crisis text line should also be on all of our student IDs, the back of our student IDs. So this next slide goes into what are people texting about? And the cool part of Crisis Text Line is it's all algorithms because it's typed, written conversations and not just someone listening. They use an incredible data analysis, AI to comb through the data, look through keywords, look through all of these. So there's very little user error in the fact that those messages are kind of being swept through with AI, right? And it happens pretty quickly. So you'll see that the top three drivers, and just again, suicide is not a one driver thing. A lot of times folks are like, yep, this is the one thing. It's usually a combination of a lot of things, and maybe particularly one thing happens. But just to make sure that we're really in the nuance of it's not just one thing, but could be several of these things going on for a person. Or that one thing is the thing that kind of put them over the top where they were already kind of feeling overwhelmed. You'll see at the top is depression, anxiety, and relationships, kind of all the time, right? We've seen a little bit of a decrease in depression, an increase of anxiety, and some of those relationships people or relationship things are shifting. You'll see school is a huge one on here. And again, I think about like, I'd want to just put everything on here. This is a lot. I can click on and off on the actual dashboard to look at things more specifically. But COVID, you'll see COVID had a spike in March and April of last year. I wonder why. It's like the thing that we actually all dealt with and are still dealing with. And you'll see it's kind of leveled off or has decreased. All of these things can be looked at individually, as well as, you know, something I didn't mention that I didn't show on the graph is that we can look at specific area codes. We can look at specific counties or regions. We can look at specific age ranges when we use this dashboard. It's very interactive. And so if there's time at the end, I'll click on that and show you kind of how interactive it is. So yeah, so Tara mentioned a parent campaign. Absolutely. Nightly check-ins, right? And think about too, we've had good conversations with Dr. Howard and, you know, former colleague Shelley, like what happens when kid gets in trouble is that a lot of times they get grounded from their phone. And sometimes that being grounded from your phone is limiting the access to a crisis text line. So, you know, I'm not a parent. I will never tell anybody how to parent, but just think about, you know, the accessibility of people reaching out, of our youth, particularly reaching out. So yeah, I love that. A parent campaign for check-ins, like check in on your kid, talk to them, right? Instead of everybody going to their corners and to their area of the social media world, like check in. Talk about what's going on. How are you doing? Can you help with homework? Right. That's a lot of times where stress comes really high with homework after hours is when you have that deadline, but you know, you also need to sleep. All right. So anybody have any questions or thoughts about the crisis text line dashboard? What are your impressions? What are you taking away from that? You can put them in the chat or, you know, any of those kind of things. I'm going to stop sharing here for a second. Thoughts, questions, concerns? And you know, you can email me. I'm going to put my email in the chat. It's also at the end of my PowerPoint. Hey, you're like, hey, I work at this region, or I work at this ad district, or I work with this, you know, this whoever, and you want to know specific information related to your area or your age or your whoever, your driver, and I'd be more than happy to put something together. This is shareable data. Again, because it's de-identified and, you know, we're looking at it from that 50,000 foot and we're just using it for prevention, right? We're not going in and trying to intervene with those folks. We're just using it as areas to be able to intervene. All right, so great data, interesting breakdowns. Yep, co-occurring issues. Yeah, definitely reach out. I wanted to give a moment to actually look at it. So I'm gonna, can you all, I need to share my screen. So this is what the actual dashboard looks like. And if any of you guys are creating a dashboard, like how usable this is and I've also leaned into some other federal partners of other things that we work with to say, hey, can we get something similar to this, because it is so great. For example, so I mentioned filters. So I can say, hey, give me the last month of information. I can come over here as soon as I break. Yeah. It takes a little second. But this helps us look at trends a little faster. It helps us do all of these things. And again, these are only a certain group of folks, right? Predominantly. And so how can we market, right? How can we get this out there so other folks are able to use it? Yeah, so Joel's mentioned as an older person, not likely text, but during crisis, but potentially for someone who's younger. Again, I think too that that's definitely something that we've thought about, and also as folks who maybe don't like to talk, we're talking and processing your feelings is a little bit harder when you have to say them out loud. I think texting and chatting is definitely something that can be helpful. So here we are for the last month. So all of that stuff goes away. We'll see like we average about 50 text conversations a day, or that goes up to about 50 per day. And again, you'll see the active rescues are in red. So for the last month, again, you'll see these information. So this is on Monday at 10. It was higher in October for some reason. Sundays and Mondays typically are a little bit higher. I think both in calls and to the National Suicide Prevention Line and text. So Sundays and Mondays, also Thursdays for some reason. The thing too that we look at, so the arrows over here, comparative, are the national average. So we are below the national average from midnight to 2 a.m., but we're above it from 10 a.m. to noon. So that's what those little green and red arrows mean. We didn't have enough because if there's not enough of a certain limit, they won't show you. But again, it looked like anxiety, stress, depression, relationships, school, all of those kind of things were the highest. You'll see suicide, loneliness, all of that. So this is the way that, that we can use this in an interactive way. So again, I have been thinking about, we could do custom. We can also do like, let's look at like all of Jefferson County. And because I just know there's going to be enough to be able to see some stuff there. So really great data set made available through relationships with and partnerships with our KIPRIC and KVIP folks. So we can stop sharing that. It takes a little bit to load, but still not bad related to the number of data that you get. So if you can see, I'm totally geeking out about this. Yeah, okay. See if there's anything else. Diana, yes. So I believe last year in the state legislation, they passed a bill, it was a year, 2 years ago, they passed a bill that had every school district put the crisis text line, the National Suicide Prevention Lifeline. I think there was a couple like domestic violence lifeline. There was a couple sexual abuse or yeah, a lot of those kind of national statewide numbers should be on your student's ID, I think middle school or above, and post-secondary too. So definitely there should be that work. And if not, let me know and we will get you connected with the legislation that says that we should be doing that. All right. So other thoughts, questions about the crisis text before I go into our next part? One thing I also didn't remember or didn't know was if a child under 17 is using crisis text line and they do report abuse, crisis text line is our mandated reporters. So they operate within that same function as our clinicians under that kind of same code. And all of us are mandated reporters. So just to recognize that as a point of safety for our young people using the crisis text line. All right, so going next to our National Suicide Prevention Lifeline. So whereas KDVRS and KIPRIC, they have the data related to, suicide suicide attempts, self-harm in emergency departments. They have inpatient hospitalization data. They have actual suicide death data, especially KDVRS does. We have access, like I said, to the crisis text line, but also how many people are calling into our National Suicide Prevention Lifeline. So as a part of my job and several grants that we've had and are, still applying for, I work very closely with our community mental health center crisis call center directors. So many of you have maybe heard, but if not, there in July of 2022 is going to be a 3-digit easy to remember number for behavioral health crisis. So what is now 1-800-273-TALK will become 988. 3 digits, easy to remember, similar to 911. So I keep saying, if your house is on fire, call 911. If your brain and mental health is on fire, call 988. That's probably not going to be the state slogan, but it's just a good way of kind of help explaining the relationship, but also how they're different. So you'll see that over, since 2015, our department is working with our community mental health centers to onboard and build the statewide capacity. So every one of these community mental health center regions, all of them already have upwards of 2, sometimes 3 specific toll-free numbers, one for adult, one for children, one for folks with developmental intellectual disabilities. We've also asked them from the department to become National Suicide Prevention Lifeline accredited. You don't just wake up one day and say, hey, I want to be a nationally accredited call center. It is a process, and a process that we've been walking alongside our call centers for the last 2 years. So when I started and when this grant started, we had a 46% answer rate, in-state answer rate. So 46% of Kentuckians that called the 1-800-273-TALK number, 46% of them were directed to a state call center. That means over 50% of them were sent to a backup center, which most likely is in either Miami or New York. I don't know about you all, but someone in Miami, someone in New York probably doesn't know the nuances, the specific stresses, all of those kind of things that go on in Kentucky. And Kentucky as a whole, from one side of the state to the next, from the top to the bottom, like their different regions have different specific like stressors or unique stressors. So our goal at the department is to make sure that we have a 90% in-state answer rate. So 90% of Kentuckians that call the National Suicide Prevention Lifeline, 90% of them are directed to a specific call center in Kentucky. So over the last 2 years, we have onboarded 2 new centers. So our New Vista call center, Darcy Miller and her group have onboarded. So they are now answering the National Suicide Prevention Lifeline for their 17 counties. We also had Pathways, which is in our eastern part of the state. They are answering their 8 or 10 counties. So you'll see that we're getting really, really close to having 100% coverage. Communicare, North Key, and Kentucky River, those centers are all actively onboarding. And this is a process. This is not, again, it's not something you just wake up and say, hey, I want to be a call center when I grow up. It is, clinical reviews, it's conversations, it's making sure your policies and procedures are best practice. There's like a clinical component to everything. And then you have to do a test call. So yeah, it's a very long process. I will say Communicare is super close. So we're about to get our 11th center. We as the department, yes. So we as a state, and also you're going to be hearing more about 988, how we as a Commonwealth can support them, therefore supporting our fellow Kentuckians, maybe even our family and friends. So you'll be hearing more about that very, very soon from someone who's not a state employee. Hint, hint, check out Marcy and Megan Cole. So there'll be lots of cool things coming from that. But I do want to give a huge shout out to that we now not only have primary coverage in all 120 counties. So right now, every county in Kentucky has a primary Kentucky center that they're routed to. In addition, over the last couple of years, through the Rural Suicide Prevention Project, which was funded by tobacco settlement funding, we now have like 50 some counties that have backup. So not only the first ring goes to the primary, but if that first ring isn't answered within 30 seconds, it will go to another Kentucky center. And that has been in partnership with our Pennyroyal call center down in kind of South Central Kentucky. So a shout out to Audra and her crew down there. They are now the primary or the backup for a lot of rural counties that, again, we're working with some of our partners to address that. We have seen over this last year, since 2019, we have seen an 8% increase in calls. So this is like outside of building the capacity to answer in state, we are getting more calls from folks. We've also heard from our call center directors that people are calling, new callers are calling. So folks who have never used the Lifeline before are calling. And in addition, the acuity of calls has increased, the length of calls has increased. So we're really starting to see some of, I think, the results of the mental health impact on COVID and all of those kind of things. Thanks, Marcy. I knew you were going to be there. Yeah, so we've seen an increase. So I said we started with 46% answer rate. We've seen an increase in overall calls. And I'm very proud to say that by the end of June 2020, we had an 81% answer rate. So in-state answer rate. So 81% of callers were staying here in Kentucky with the regional call center that knows the region, knows the linkages, knows the resources, and knows the particular stressors. So this is a line of, the increase that we saw in our answer rate marked by kind of what had happened. So we started a grant. We contracted with 3 centers that were, kind of had the capacity to do higher volume. We had them answer calls from outside of their county regions, while the other community mental health centers, they stood their call centers up. So then you'll see where Pathways came on, you'll see where New Vista came on, and every time we've added a call center, we've increased our in-state answer rate. And that's only going to get better when we add the 10th or the 11th, 12th, and 13th. So very, very excited about that. All right, I have talked and talked and talked. So I want to, I don't know why it says poll. I want to take a second and again, think about what can we do with this? What can we do with this information? You in your lane, in your role, in your profession, in your family, in your community, what can you do with the information that that you've heard today, that you've talked, that, that I've presented, that, other folks have presented, what can we do? What can we do as a state at the macro level? And what can you all do as individuals and community members within families and communities and counties? So Heather, you asked, the increase in calls is due to COVID. I do think that there has been an increase in calls related to COVID. So I think, yes, in part to other things, potentially more marketing. I think COVID has really opened up a window to be able to talk about mental wellness in ways and mental health in ways that we maybe have not had before. Yeah, so Mental Health America, their mental health screenings, they've seen an increase. I think 2020 they saw a huge increase in spike in folks being doing that online assessment. So I think, again, it is because of the specific stressors of COVID for sure. But I do also think that that's in relationship to how folks have been talking about it. And there's, I don't want to say we're there, but we're getting closer to kind of normalizing help seeking, normalizing talking about what's going on with us. If we're not feeling like ourselves, if we're having a hard time getting out of bed or having a hard time like kind of just going on. I do think we're talking about that more with people and we're sharing more resources. So like I said, it brought us together as data partners. And I think it's really brought a lot more people together to talk about, what's going on with you. So yeah, I think that's a great question, Heather. So yeah, what can we do? So think about what's one thing. There's 44 of you on here, so let's all put something in the chat, or if you can put something in the chat. What can you do? One, information. Is that talk to your kid? Is that, present this data to your PTA? Is it, reach out to do question, persuade, refer, QPR training? There's folks across the state too that do mental health first aid. Those trainings are a day long, but it's phenomenal. It really helps kind of increase your mental health literacy and your ability to intervene. So yeah, what are folks thinking? I know it's hard to do this in this virtual format, but I believe in you. I believe in us. Listen, be aware, for sure. Absolutely. I've seen people put the crisis text line marketing in their email tagline or their email signature. So, simple check-in, talk to people, absolutely. Fan the advocacy flame, yes. Share the graphics, right, with your prevention educators, right? We each have a lane. Each of us have a thing that we do. And if we could just implement one or two small things of other people's lanes, I keep saying know your lane, but know that you're on a freeway of a lot of people doing a lot of good. So yeah, I love that. Sure, thank you for sharing. Get youth involvement, right? I know you work particularly with youth. So what do they think about this crisis text line? What can, how do they think we could best get in front of more male identified folks or, younger guys? More QPR trainings? Yes. We do have over now, again, thanks to funding from partnerships, we have over 350 QPR trainers across the state. So if you need a QPR training, you reach out, we will find you someone to do it. And we will provide the books and we will provide the time. So if you're in a church group, if you're in, quilting club, I recently just trained my CrossFit coaches in QPR. So we want to just, again, kind of get in front of folks and be talking about this. We know too from historical data that it's about 3 years after a traumatic kind of event that we'll see the effects of. So after September 11th, there was a kind of a honeymoon period of kind of coming together, of feeling connected potentially for some folks, and so we kind of saw that with COVID, and we're going to be seeing the effects, and we can be proactive and we can be preventive in kind of getting all of this message out there as much as possible. Yes, mental health parity, Diane, for sure, making as important as our physical health. Absolutely. If you're a primary care physician or if you work in a healthcare setting, please, look at Zero Suicide, the framework. Are you screening every person at every visit? There's statistics that say, folks will have seen a primary care physician a week or a month before their suicide. And that's a missed opportunity for us to check in with folks, especially our rural male identified folks. They're not going to potentially seek out mental health care. They might go see someone for a bad knee or back pain. So I'm really making sure. I work with Jennifer Perry at UK, and she says that the kiddos that she see, they'll say they have a stomach ache or a headache. And she just asked them like, hey, sometimes when some folks come in with a stomach ache or a headache, they're really kind of struggling with mental health. Is that something that's applicable to you? So it's like, know some of these, like, I don't want to talk about it, but I want you to know something's going on with me. So, again, are you a primary care physician? If so, let's talk. Let's increase a screener. Let's increase a suicide care pathway. Everybody knows the warning signs for stroke, right? There's a whole acronym, FAST, for it. But how can we, and again, in a public health way, in a public health campaign, get out the suicide warning signs? And that's through QPRs. It can't fit in a four-letter acronym though. So ours would be like a paragraph acronym. So we'll have to really work on our messaging. All right, any other questions? This is my email. This is my, this is how to get a hold of me. I really hope that you do. I love hearing from folks. I love hearing what your particular needs are, how we can partner with you, how I can partner with you, how I can connect with people across the state. So there are 2, 3 kind of state level organizations. So American Foundation for Suicide Prevention, Megan Cole is their executive director. They do a lot of things with research nationally. They have walks, Out of the Darkness walks. We have our Kentucky Suicide Prevention Group. You can research all of these online. They all have websites. They all meet once a month. We have the Suicide Prevention Consortium of Kentucky. Both of those 2 groups are our, statewide coalitions. Owensboro has the Owensboro Regional Suicide Prevention. If you know of someone in your area, please put it in the chat and share it with folks. But there are lots of folks doing lots of good things, and hopefully we just get to connect people. So yeah, that is all I got.